Hi there, this is Patrick Ellsworth with the Regis Physical Therapy Program, and I want to take a moment to talk about the science of pain. Simply put, pain is an unpleasant sensation created by the brain in response to certain stimuli. Now, humans have special receptors on our skin and in our body called nociceptors that detect mechanical, chemical, and thermal stimuli and then transmit messages through our nervous system to the brain. Now, these neural messages will tell the brain that there is danger or damage to the body and that action is required. The brain will interpret these messages and then initiate action to reduce the danger to the body. This might include quick movements away from the stimulus or protective action such as grasping an injured limb or walking with a limp. So in a case of acute injury, when your body is injured and there is tissue damage, your body will become more sensitive to other stimuli, particularly around the site of injury. Now, this is known as peripheral sensitization, and it acts as a protective strategy, helping to prevent further injury as well as protecting damaged tissues while they heal by encouraging you to protect and guard the injured area. Unfortunately, sometimes this hypersensitivity in the nervous system can persist after the injured tissues have healed. This is known as central sensitization, and it causes your pain system to be more easily triggered even when there is no real damage to the body, and this is a key contributor to long-term chronic pain. So I want you to consider a fire alarm. When a large fire occurs, the alarm is activated and sends out loud warning signals in order to protect you and warn you that there is danger that you need to avoid. But if that fire alarm becomes too sensitive, then it might send the same loud warning signals for something as small as a candle. Now, obviously, this would be very disruptive, and chronic pain works in much the same way. This is not to say that chronic pain is all in your head, like some previous thoughts were, but rather it is your brain creating a pain response to real pain signals from an overly sensitive nervous system. So, how can we mitigate this? How can this be solved? Well, medication can be used to help in some instances, but pain is very personal. So it's difficult to use medication for a simple one-size-fits-all approach that would work for all patients. Fortunately, though, there is significant evidence that physical therapy can be used to treat chronic pain. So using a gradual approach to mobilize and strengthen tissues coupled with manual therapy can help build patient confidence in their own bodies and their ability to move. And the hope is that this will empower them to take control of their long-term health and to reduce the prevalence of chronic pain and to improve quality of living for so many patients. Thank you.